My dear friends, I am Dr. Omkar Prasad Baidya, MD PhD from King George Medical University, Lucknow. Today I will be speaking on an important topic, COVID-19 and its manifestation or involvement of cardiovascular system. That is, how the COVID-19 or coronavirus 19 infection affects heart and cardiovascular system. To start with, COVID-19 is one of the important burning problem or most important health emergency throughout the world. It has developed a pandemicity throughout the globe, and almost every country it touches as pandemicity and infectivity. Throughout the world, the number of death and morbidity and mortality is rising, though there are number of patients who have survived from this infection is also increasing. Actually, the role of immunity in handling this virus is very much important. Now, once the virus, which is an RNA virus, or also we can define as a respiratory virus, as it spreads mostly by respiratory tract, hence is affinity for mostly for lung. But in various studies at various parts of the world have shown that it has important effect on the heart also, especially on cardiovascular system. Now, this respiratory virus, that is COVID-19 or coronavirus 2019, is an RNA virus or a respiratory virus of coronaviridae family, which has affinity for a receptor angiotensin converting enzyme 2, which is mostly present in the lung and heart. In the heart, it has mostly present in the cardiac myocyte as well as on the vascular epithelium. So when the virus enters into the respiratory tract, from there it travels to the heart and infect the cardiac myocyte, because cardiac myocyte on its surface has huge number of angiotensin converting enzyme 2 receptor, and this enzyme is very important in development of diabetes and hypertension. So this enzyme has been targeted by this COVID-19, and once it targets the host cell, the virus destroys the cardiac myocyte, and that's why that is the reason behind the cardiac injury or myocardial epithelial injury or myocardial loss or the cardiac involvement in COVID-19 infection. Now, studies throughout the world at various parts of the world, is in USA or in Yuan, China, or in Italy or France, it shows that many cause of death in later stage or in the most severe complicated stage of the COVID-19 infection may be because of cardiac involvement, like in heart failure or myocardial infarction or left ventricular dysfunction or stroke or thrombotic events or myocardial injury. So these prove that COVID-19 has its manifestation or involvement of heart and vascular system also. Now, how it affects the heart, all of you know it is affecting the angiotensin enzyme converting enzyme 2 receptors on the surface of the cardiac myocyte. Now, how it affects the other systems of heart, we should know one by one. So, what are the various complications in heart by the COVID-19? Number one is heart failure. Heart failure is failure of the heart to pump out the blood. That is decreasing cardiac output. It may be of various causes, but cardiac failure may be manifestation of cardiac injury, acute cardiac injury, which is because of COVID-19 infection. Especially those patients who had previous heart failure or patients taking medicine for heart failure, when they are exposed to COVID-19, there is a high chance of development of heart failure in the later stage of the disease. That's why for those subjects or those patients who are suffering from heart failure or any coronary vascular disease or cardiovascular disease should take special precaution in prevention of the disease, as the disease may be life-threatening in those subjects. So what are the COVID-19 cardiovascular manifestation? Number one is that it may lead to heart failure. Number two, it may lead to cardiac arrhythmia, ventricular arrhythmia, ventricular fibrillation, atrial fibrillation, and so on. So arrhythmia means when the rhythm of the heart is not normal, when the heart is beating in a different rhythm, abnormal rhythm, we call it ventricular arrhythmia. Then it leads to ventricular dysfunction. Ventricular dysfunction means ventricular function is to pump the blood, that function is not working well, so we call it ventricular dysfunction. Or it may lead to myocardial injury, direct myocardial injury, and it may lead to thrombotic event also. The thrombotic event, it may be because of sudden immunological response in the later stage of the COVID-19 infection, when there is a chance of cytokine storm, and because of that there is huge number of inflammatory mediators, cytokines, inflammatory cells, C-reactive protein, and which stimulate the systemic inflammatory response syndrome and ultimately increase the D-dimer and makes the coagulopathy of the blood increase the coagulation capacity of the blood, and there is a chance of increased thrombosis and thromboembolism. So thrombosis and thromboembolism may be various causes of death in cardiovascular complication of COVID-19 cases also, and for them the D-dimer assay has been found to be very much high. Beside that, there will be chance of pulmonary embolism also, pulmonary embolism, pulmonary edema, pulmonary hypertension, which may be cause of death in some cases, which has been studied in various parts of the world. Besides, there will be chance of electrolyte disbalance, because hydration status of the person may be changed in course of the disease or in course of the suffering from COVID-19. Then because of electrolyte disbalance, there will be some cardiac manifestation. So what are the COVID-19 cardiac manifestation? Number one, it may be because of heart failure, it may be leads to myocardial infarction or coronary heart disease or cardiac arrhythmia, ventricular dysfunction, myocardial injury, then thrombotic events, thrombotic disorder, then electrolyte disbalance and its cardiac manifestation. Now let's see how the myocardial injury occurs. The myocardial injury occurs because I told you the myocardial cells or cardiac myocyte is flooded with so much of angiotensin converting enzyme 2 receptors, and the virus COVID-19 binds with these receptors and cause direct damage to this cardiac myocyte. And any other cause, maybe it may be because of inflammation of cardiac myocarditis also, inflammation of cardiac myocyte, the myocardial injury may be result of that also. Beside that, in the last stage of the disease or the later stage of the illness, there will be chance of cytokine storm, or because of severe immunological response, huge amount of increase in the cytokine level in the blood, and which is known as cytokine storm. And because of the cytokine storm, it may lead to cardiac injury or myocardial injury. So these are the various effects of myocardial injury. Number one is direct injury by the virus by its effect on the angiotensin converting 2 receptors because of myocarditis or myocardial inflammation, or because of severe cytokine release phenomena, which is also known as systemic inflammatory response syndrome, which may occur in the later part of disease, and which is also known as, which is better known as cytokine storm, and because of that it may lead to myocardial injury. Okay, now what are the who are the higher risk individuals, or who are the subjects who are prone to these cardiovascular complications? Mostly those patients having previous heart failure or arrhythmia or supraventricular tachycardia, or having history of myocardial infarction or defective ventricular function, especially left ventricular function, or coronary heart disease, has a higher chance of passing a life-threatening situation when they are exposed to this virus in the later stage of the disease. So those subjects who have who has a history of hypertension, previous coronary vascular disease or coronary heart disease, or life-threatening arrhythmia like atrial fibrillation or ventricular fibrillation, must be very much cautious or over-cautious in this coronavirus or COVID-19 pandemic, because these patients, when exposed to COVID-19, may have a chance of go into a stage of cardiovascular failure because of COVID-19 infection and its complication. Now, how to diagnose? Now, all of you know ECG is very much important in diagnosis of cardiovascular disease, and it is we found that there in various studies throughout the world that ST segment elevation has been seen in various persons who has not suffered from previous heart disease also. This proves that ST segment elevation may be seen in case of COVID-19 infection and its heart involvement. At the same time, there will be sign symptoms of sinus arrhythmia or supraventricular tachycardia can also be found. Besides, non-invasive techniques like CT angiography or MRI angiography shows myocardial interstitial edema and myocarditis and myocardial inflammation. This proves that in the cases of the infection by COVID-19, the heart is involved, especially the myocardial myocytes are involved, and which leads to myocardial inflammation, myocardial edema, myocardial interstitial edema, and myocarditis. Okay, so this proves the heart is involved in case of COVID-19 infection. Besides, autopsy of various patients who has died from COVID-19 cases in various parts of the world have shown that there is interstitial inflammation of myocyte and clinical features of myocardial dysfunction. So this proves that COVID-19 patients may also die because of a heart failure or because of left ventricular dysfunction, because heart is another important organ which may be infected or involved in COVID-19 infection. Another important thing I should not forget to tell you that sometimes clinicians use hydroxychloroquine in the pneumonia treatment, or sometime in some countries to prevent the complication of the, or as a therapy to prevent the COVID-19 infection. So hydroxychloroquine or chloroquine, sometimes if is given along with azithromycin, which is an antibiotic to prevent the super infection, leads to QT changes or leads to life-threatening toxicity they point is, which is a arrhythmic situation and leads to sudden cardiac death. So for those clinicians who are using azithromycin along with hydroxychloroquine, they should be very much cautious in handling these patients of COVID-19, because that may leads to toxicity they point is and leads to life-threatening ventricular arrhythmia leading to sudden death in COVID-19 infection patients. So the clinician must be very much caution in providing or giving hydroxychloroquine or chloroquine therapy in the COVID-19 infection. They should not be used simultaneously with azithromycin, which is an antibiotic to suppress the antibacterial superimposed infections. To summarize, let's see how COVID-19 causes various cardiac problems. Actually, it causes acute cardiac injury by directly damage to the cardiovascular system. How it is affecting? Because it has so much of angiotensin converting E2 receptors, and virus bind to this receptor and directly damage the host cell. That's why, just like it causes respiratory failure, it may also leads to cardiac failure. It may also, COVID-19 infection in the later stage may leads to systemic inflammatory response syndrome, also known as cytokine storm, where there is increased or huge amount of cytokine in the blood will increase, or inflammatory mediators will increase, which leads to a direct myocardial injury, and because of that heart may fail also. And not only heart, it may lead to multi-organ failure, even kidney failure also, and may lead to sepsis. And this sepsis also may also affect the heart directly. Another important mechanism is that in COVID-19 cases, because of the systemic inflammatory response syndrome, or because of the cytokine storm or immunological response, it may stimulate the DIC. What is DIC? Disseminated intravascular coagulation, or makes the blood thrombotic. Means it increases the coagulation of blood, increase the chance of coagulation of blood, and because of that there is a chance of thrombosis, more specifically venothrombotic embolism, chance of venothromboembolism or thrombosis, especially pulmonary embolism may occur, pulmonary thrombosis may occur, which may lead to pulmonary edema and respiratory failure also. At the same time, it may also lead to chance of thrombosis in coronary artery leading to myocardial infarction, or in cerebral vessel it's to stroke. So again I am telling, so COVID-19 infection may increase the chance of thrombosis, and which may lead to increase the chance of thrombotic events, and ultimately patient may die of stroke and myocardial infarction. And even this myocardial infarction or stroke may affect the respiratory center, and even the person may die of respiratory failure also. So these how COVID-19 cases involve the multi-organs together. It affects the kidney, it affects the lung, it affects the heart, and all the systems are involved, and infection or inflammation or involvement of any other systems may involve the other systems, and person may go into a stage of death. Now, chance of thrombosis or coagulopathy, the proof of the sign that there is a chance of thrombosis or chance of thromboembolism or thrombotic disorder in the patient suffering from COVID-19 in later stage. One of the important proof is rise of D-dimer in the blood. D-dimer is an assay or a protein. If it is found to be increased in blood, this shows the chance of thromboembolism or systemic disseminated intravascular coagulation. So proof of DIC is D-dimer assay. So, and in most of the cases of D-dimer assay, in most of the cases of COVID-19 patients, D-dimer assay has been found to be increased, which proves that the blood become hypercoagulable and there is a chance of thrombotic disorders. Also at the same time, in COVID-19 cases, there is a systemic vasoconstrictive response in various vascular beds. In pulmonary vascular bed also it causes severe vasoconstriction, so which leads to decreased oxygenation and leads to hypoxia, and which may affect the cardiovascular system as well as respiratory distress. So this proves that COVID-19 may infect the cardiovascular system, and because of that it may involve the vascular epithelium or direct myocardial injury, and which indirectly or directly may involve the respiratory system, and person may go into a stage of respiratory failure. Thus, we can see that especially those patients who have previous heart disease, heart failure, arrhythmia, or myocardial infarction or hypertension, they should be very much cautious in this COVID-19 pandemic season. They should take the therapy, they should regularly take the medicines, antihypertensive medicine, anti-arrhythmic medicine, or anti-heart failure medicine, so as to keep the cardiovascular fit, so that the chance of morbidity is decreased even if they suffer from the infection. Thank you very much. Let me know how you